When you're in addiction, you searched high and low to get the good stuff. When you're in recovery, you're doing the same thing. You're looking for the good stuff. No longer is it drugs and alcohol, but it's the good stuff. And when they come to us, they find it. And they start getting those gifts of recovery. It might not be the same as a bottle of vodka, right? It's not going to give you the same impact. But there's also no reason to look in the mirror next morning and feel bad about yourself.
Welcome to Beyond Theory, a podcast powered by Meadows Behavioral Healthcare that brings you in-depth conversations with firsthand insights from the front lines of mental health and addiction recovery. I'm Dominic Lawson. The path to addiction has many layers, and when a patient has co-occurring disorders, those layers become more abundant and complex. Dr. Dr Fourlas says that just treating the symptoms isn't enough, and that going to the root of the problem is the one true path to recovery. But what does it take to get to the root cause? Let's get out of the abstract and see how this applies in the real world. It's time to go beyond theory.
I am Dr. Dr Fourlas, but I go by Georgia, and I am the clinical director of Rio Retreat Center at the Meadows, which is our workshop department.
Dr. Fourlas, thank you so much for coming on the Beyond Theory podcast. We really appreciate your time.
Thank you for having me.
If you would, just kind of share with us your background.
I have been a social worker for a really long time. I got my master's degree in 1997 and at Temple University. And I have been, yes, the Owls. And I have been in the field ever since, with the exception of 2 years that I took off, but pretty much ever since. I started out primarily working with trauma, particularly with women and children, and morphed into working with trauma and addiction.
What was it about women and trauma that attracted you to that work?
Some of my own history.
Okay.
Like I was bullied as a kid, and some of it was, then I ended up in some intimate partner violence situations. And so I was drawn to that. And I was always interested in helping people with sexual violence. So I was helping women and children, and some men as well. It was not just women and children, but more so women and children.
Understood. And you're at Rio Retreat now. Kind of talk about your role as clinical director a little bit, in detail, some of the work you do there, stuff like that.
So in my role as clinical director, I make sure that our programs are all clinically sound and that we have master's level or better therapists that are providing the top quality clinical services that someone would expect from one of the Meadows programs in Rio Retreat Center. So I supervise a staff of 9 people. They each run Survivors workshop. Everybody on my team runs Survivors. And then in addition, some of them run specialty workshops in their own specialized fields. For example, we have a couple people that run men's sexual addiction workshop. They are CSAT, certified sex addiction therapists. We have people that run couples or family who are LMFTs, licensed marriage and family therapists. So I'm making sure that I have a team that specializes not only in the workshops that they do, but also that they specialize in doing it in a workshop format, meaning in an intense 5-day format where they're with people all day.
Try to, if you would, kind of crystallize the workshop format. Like, what does that look like as opposed to what we do at other facilities here at the Meadows?
So most of our workshops are group-based. We do have an option for a private intensive, which is a private workshop, which is not based in group, which I'll talk about later. But most of our workshops are group-based, no larger than a group of 6. That's our largest group. And one of the ways in which it's different is that it's very specialized, meaning people choose the workshop specifically for the issues they want to address. And secondly, it's done in a highly specialized way. So we do 5 days of approximately 6 hours a day. The last day is a little bit shorter, but approximately 6 hours a day of therapy, group therapy. One of the differences between doing it in that way and getting the same amount of hours in an outpatient therapy setting with a therapist that you're seeing once or twice a week is we eliminate some of the need to check in each hour, right? We check in the morning, we check out in the evening, but during the day, we get to take a deep dive into whatever the issue is that that person wants to work on.
One of the things I keep hearing about is survivors, right? Everybody raves about survivors. Kind of share with us about that, Dr. Fourlas.
So Survivors is our signature workshop. We've been doing it for years. We do it every single week at Rio Retreat Center. The only weeks we take off are Thanksgiving, Christmas, and New Year's. And in the inpatient, we even do it, because we do it also in our inpatient program, Survivors. My department runs that within the inpatient. And we even run at Thanksgiving, Christmas, and New Year's for those folks because they are in treatment at those times. It's for people to look at their family of origin or childhood trauma that occurred between 0 to 17. We look at it through the lens of Pia Melody's model in her book, Facing Codependence, and we look at how people's childhood impacted them and what issues it is leading to or contributing to in their adulthood. And basically, one of the underlying premises is that your childhood knocked you away from who you are authentically, the valuable, vulnerable, special person that you were born to be. Things happen. I always like to say no one gets out of childhood unscathed. Things happen that make people feel like they're better than others or less than others. Like they can depend on others, that they can't depend on others, that they're overly vulnerable with others, that they wall off from others, that they are out of control, that they need to be always in control. So there are things that take people out of their authentic self and who they maybe were meant to be and lead them into addictions or mental health issues, depression, anxiety, troubles with relationships, stuff like that. So we try to look at the core of those issues, whatever the adult issues are. And we look at it like a tree. If you picture a tree, the branches of the tree would be addictions, all different kinds of addictions, mental health disorders, anxiety, depression, troubled relationships, family issues. Most treatments look at the symptoms. They cut off a branch of the tree. But what happens, most people have done a little landscaping, then tried to cut a bush themselves. What happens when we cut off one branch of a tree? Another one grows back either in that place or in a different place. So if we really want to address this problem tree, what we need to do is look at the core. We need to look at the core, which would be the trunk, and we need to look at the roots of that and get to the roots. And the roots of many addictions and mental health issues are shame, pain, and issues from their childhood that they have yet to address.
One of the things that I've often noticed is that when there are people who know they need to get treatment, right? But oftentimes that stigma of getting treatment is a barrier. Could you talk about that a little bit, Dr. Fourlas?
Absolutely. And I would say that's one of the things that makes our workshop department a little bit different, where some people, and we're not a substitute. Let me say first, we're not a substitute for inpatient treatment. But for someone that doesn't really need inpatient treatment but wants to check out what it would be like to get some help, because we have it in the abbreviated 5-day format, they can come and check that out without going inpatient, without committing to anything long term. Oftentimes what we see is once someone's able to get an experience that's positive with a therapist or with some form of treatment, they start to experience the gifts of recovery or the gifts of the healing journey, and then they want more. And they'll either come back for further treatment, or they'll go and sign up for a therapist in their hometown, or they might, seek 12-step recovery or some kind of spiritual healing for themselves. But my experience has been once people experience the gifts or get the gifts of recovery, that they want more of that.
And you talk about this often where, they want more of that. I'm always just curious about, you talked about where you can get this additional treatment, additional help, and stuff like that. What are some of those, I guess, if you have a story or a few stories that have shown that like that continued treatment, that continued going through the process has been super beneficial? That many, huh?
Yeah, that many. That many. There are a ton of stories. I mean, we have people that are repeat customers that they come for one workshop or they come for one experience with the Meadows and they come back for more and they keep coming back because every time things get better for them. Whether it's inpatient treatment, outpatient treatment, workshops, they leave and they feel better. Their depression is lighter. Their anxiety is relieved. They are less likely to act out on their triggers. They feel more regulated. They feel more connected. And so I guess the biggest answer to that would be once people experience it, kind of like you said, I don't know how better to characterize it than this. I always like to tell people that are in addiction this. When you're in addiction, you searched high and low to get the good stuff. When you're in recovery, you're doing the same thing. You're looking for the good stuff, right? No longer is it drugs and alcohol, but it's the good stuff. And when they come to us, they find it. And they start getting those gifts of recovery. It might not be the same as a bottle of vodka, right? It's not going to give you the same impact, but there's also no reason to look in the mirror next morning and feel bad about yourself. Your family starts to come back to you. Your true friends start to come back to you. You're able to stay employed. You feel like you're a little bit more financially stable. In addition to the things I mentioned previously about the depression lifting and anxiety being relieved. So people start to feel like there's a reason to pursue this.
It's funny you mentioned that. We spoke with Hamilton Baden. Hamilton Baden is the president of Heritage Cares, one of our partners here at the Meadows. And he said going through recovery is one of the greatest things he's ever done. And so when you were speaking about that just now, it reminded me of that. So thank you for sharing that. But you also said something that I thought was interesting when you talked about the familial aspect, family members. Talk about that process of the family members kind of going through the workshops with some of the patients or clients. I guess I'm curious about that because that's something we don't hear too often about we always hear about the patient, but not necessarily the family member or the friend who is going through that journey with them. Could you talk about that a little bit?
Well, I can. I mean, I can talk about it in two different ways.
Okay.
First off, we see people coming for their own workshop, which does not involve a family or a friend. They're coming for their own workshop. But later, some of the feedback we'll get from them is, we get just yesterday, I got somebody that called us to come for a workshop. And the reason that they're coming is they saw their spouse went through the workshop and made such amazing progress that they're like, I want some of that too. Right? I see how great they're doing. It shifted my marriage. And now I want some of that too. The other piece of that, so some of it is just the impact that the internal changes make in the ability to have connections and relationships. You can tell someone until you're blue in the face how much work you've done, but what really matters is what they see. The other part is in our workshop department, we have couples and family workshops. So there are workshops where you can directly involve your spouse or your family. We get a lot of people who have been in recovery, maybe for sex addiction, maybe for alcohol addiction, and they have not had a chance to really bring their family together since they got into recovery to reconnect in a way that incorporates recovery. Recovery shifts a family. One of the biggest indicators of someone getting into addiction is a family history of addiction. One of the biggest indicators of someone getting into recovery is having a family member in recovery. So a whole family can shift, and sometimes families and couples need help to do that. Maybe they don't need to go to a long-term treatment program for the family or couples issues. I'm not even sure how many long-term treatment programs have intensive long-term family help. But therapists do. And the other option is to come to a workshop and get that stuff out. We had a family there not long ago. The parents had gotten into sex addiction recovery. One parent was a sex addict. The other was the betrayed partner. They had been in sex addiction recovery together for a very long time. Their children had been very small when they had gotten into recovery. And they never told them because the kids were so small, it wouldn't have been appropriate to tell them at that age. Now the kids are teenagers, older teenagers. One of them is going off to college, and the family wanted to be able to be more open about the issues because they feared that their kids might repeat some of their behaviors. Right. And so they brought them to our workshop, our family workshop, to be able to share that with them in the best way that they knew how.
One of the things, and thank you for that, by the way. One of the things I love to hear, and you just talked about this, is you're not only helping with the patient themselves, but it seems like there's this positive byproduct. Like you help this person with their addiction and, go through recovery. They were able to save their job. You help this person to go through addiction and now they're in recovery. They were able to save their marriage. You help this person to get through addiction, go through their recovery, and they was able to save the relationship with their kids or something like that. So I'm always fascinated to hear those stories. So I appreciate you sharing that. You about to say something. Go ahead.
Yeah, I want to add something to that. The other thing that particularly workshops does is we've helped somebody in the Meadows main campus, in one of our inpatient programs, we've helped someone get into recovery, and it has helped all the things that you mentioned. And one of the things that workshop does is helps people stay in recovery. Because a lot of times after someone gets into recovery for one thing, we call it whack-a-mole, right? One issue, you come in for alcoholism. Maybe after you leave treatment, you're doing great with your alcoholism, but now you're spending a lot, or you've started looking at porn online, or you've started gaming, whatever it might be. You have all these other issues popping up. We call it whack-a-mole because I don't know if many people that are listening might have heard of the fair game,
right.
whack-a-mole.
I'm very familiar with whack-a-mole
yes,
myself.
Me too. I'm not so great at it. I am familiar with it. And so one thing pops up, you hit that, another pops up. And so people need additional help to address all those things that might not rise to the level of what sent them to treatment. Right. And they don't want to let it rise to that level. They don't want to let it get so bad that they're back in inpatient treatment or they're back hitting all the bottoms that they hit before. Now they know what recovery is, and they want to keep their recovery. They want to have advanced recovery.
Now, we talked to Scott Davis earlier in a previous episode, and he spoke about the military population and coming in for PTSD. And he said, you ask them, they come in for combat trauma. It's like, well, maybe there's other stuff going on there. So when you talked about the whack-a-mole, it reminded me of that. And we also know that recovery is not cookie cutter, right? This person's needs is different from another person's needs. And you talk about often that maybe somebody has gone through that recovery, but they actually do need that extra, help. Kind of talk about that a little bit.
Absolutely. I mean, people go into recovery and they've escaped the pain of active addiction. However, after they get kind of, I hate to call it a cloud. I hate to call it the pink cloud because I don't think it is. I think that can last.
Right.
But even on the pink cloud, like the human condition is you're going to have pain, right? You're going to experience struggles again. It's going to happen. So for some people, the pain of reality hits. And so they address the pain of active addiction or active mental health disorders, and now the pain of reality, the pain of the past, the things that happened that contributed to them having the issues they had, the pain of the present. Maybe they are unemployed. Maybe their family dynamics aren't yet healed. Maybe they're still in a separation. Maybe they're getting a divorce. Maybe their children won't speak to them. And the pain of the future. Maybe they have lost the career that they worked so hard to get, and they don't know what they're going to do next. Maybe they spent their retirement, their whole retirement money or put themselves in great debt. Maybe they've gotten felonies because of their history. And so the fear and the pain about the future and all of those realities are things that they need to look at. And oftentimes they need support to look at those things and to address some of those things.
I appreciate you sharing that. And, as we wrap up here on the Beyond Theory podcast, Dr. Fourlas, let me first say thank you for coming on the show. I really appreciate your time. And you were talking about fear of the future. We're in the middle of school being started again, and some people are going back into the classroom and things of that nature. And we talked about, bullying and things of that nature earlier. I guess I'm just curious if you could, advice for parents as they send kids back into the classroom, or maybe they're still virtual learning. I guess the fear of the unknown as we move forward, with school in the classroom, not in the classroom. Kind of talk about that a little bit, if you would, Dr. Fourlas.
Yes. I think that you bring up a great point. I mean, not only the fear of the unknown, but sometimes for parents, in addition, is their own childhood stuff that they haven't yet addressed.
Right.
And so that comes up, like if they were bullied as a kid, they're worried about their kid. And so the one thing that I would say to parents that's most important right now is to take care of yourself. Right? For parents to address the issues that they have, to work through their own fear, which will help them then work through the fear for their children and the fears of their children. Kids are scared now too. And they're picking up their own fears, but also picking up their parents' fears. And that is one of the things that we deal with in survivors, is the fears and shame and pain that people picked up from their parents. Nobody's going to parent perfectly. The best anyone can do is to deal with their own issues so they don't pass those along to their children, and to be as supportive as they can with their children. I heard this saying one time. I wish I could remember who said it, but somebody said this saying that said, the world is going to knock your kid around enough. All you need to do is love and support them.
I hear that, and I appreciate you sharing that. Dr. Fourlas, if you would just kind of share with the Beyond Theory audience just a sense of hope, for the future. There's a lot going on right now. Just kind of share some words of encouragement, if you would, Dr. Fourlas.
I think that when we look at history, and this is what I've been doing for hope, right? When we look at history and when we look at all that the human condition has given us, and we look at all that we've come through, I like to keep in mind that the human spirit and human connection has carried us through many things. And I like to think about New York City and 9/11 and it makes me want to cry talking about it, but what a horrible, horrible situation that was. And the way that we healed from that and continue to heal from that are by coming together, by being kind and helpful to one another, by leaving our politics and our opinions at the door about some of the things that are happening, and just trying to stay in love with one another. When we're able to do that, I believe that healing is inevitable. We see it time and again that we as human beings rise the best when we are coming out of very difficult situations. We do well in crisis.
Dr. Georgia Fourlas is the Clinical Director of Workshops for Rio Retreat Center, part of Meadows Behavioral Healthcare. She has worked in behavioral health for more than 20 years and has extensive experience working with adults and children as a crisis counselor, trauma therapist, and addictions therapist. Find out more about her work at rioretreatcenter.com. Beyond Theory is produced and hosted by me, Dominic Lawson. You can discover more, including videos of some of our conversations, at beyondtheory.com. For more information on Meadows Behavioral Healthcare, go to meadowsbh.com. Finally, thank you for listening, and I hope you join us next time for another episode of Beyond Theory.